Hey, it's William McComb here, social worker, chemical dependency counselor.
And John Corey, LCDC3 and student nurse.
Yep. And we're with Clinic 5. We are a behavioral health recovery clinic here in Columbus, Ohio, in the Grandview area, located at 5th Avenue and Northwest Boulevard.
Yes, and we've been here for over 11 years, surrounded by the top-notch clinicians in the field of addiction medicine as well as behavioral health sciences. And, first off, our mission, we provide an environment that is stigma-free, that is, when you come in, when you open up about the addiction and the things that you are working on, you're not going to feel guilt, you're not going to feel shame. A lot of the places that provide addiction services, they don't prioritize that in their care, and know that when you come here, you will not have to worry about that.
That's right. Building relationships is something we pride ourselves on here. Getting to know you and your needs individually is really important. And I think one of the reasons we're able to be stigma-free is because most of our staff here, if not all, but I think most is fair, has experience either with addiction recovery personally or somebody in their household. And I think that makes all the difference in terms of understanding what our clients are going through.
Okay, so at your first visit, it's a big step for you, so just know that we've got a very easy process. You'll be inducted by one of our induction specialists, then you'll be seen by the doctor, you'll be treated, and then you will kind of have the whole plan, whether it's weekly, bi-weekly, monthly. We're going to build you up to that monthly appointment. Once again, though, you will have all the resources to reach with us and stay in communication. So if you have any problems that arise, you can quickly get in touch with us.
Yeah, and we are open every day, you're right, Monday through Friday, every morning, and so you are always welcome to come in. So even after that first appointment, if you want to come in and attend group throughout the week, we encourage that for our new patients.
Very much so. So just know that when you first come in, I know it's a big step, it can be scary, it can be overwhelming, but you're coming into a place that is accepting of all the things you've been through and ready to get you back on that mission, that path that we know you're capable of.
Yeah, and you find our patients are very welcoming as well.
Yeah.
I'll go ahead and speak for them, but they've been through this as well, and our patients who have been in recovery for a long period of time, they are more than willing to help and be that peer support for our new patients as well.
So what we provide a mix of services. First and foremost, we do the behavioral health services as well as medication-assisted treatment if you're interested in that, and we combine the two to create this recipe for your recovery that is individualized at finding not only the problems in your life, but your strengths to tackle those problems.
Right. And the medically assisted treatment for people that's appropriate for is key because of the withdrawal. This medication, together with the doctor, will create a plan to medically manage those symptoms of the addiction, the withdrawal, and the cravings that make it so hard for people to actually find help and to make that decision to change.
And also, we do group counseling and individualized counseling. We do case management. You've got an all around the board different ways to attack this addiction and find out what works best for you.
So Clinic 5 is a fee-for-service clinic, which means that we don't take insurance for the doctor visit and the office visit. However, most people's insurance will cover the medication and will also cover like their lab testing and things like that, right, John?
100%. Yep. So with that fee for service, we do offer a flexible scale for you to accommodate. So when you come in, we'll assess you, we'll get you treated, and we'll work with you to not only afford it, but even if you can't and you decide or you do not want to stay with us because of that fee for service, we got a plethora of other places we can send you to that will meet your needs wherever they might be.
Yeah, that's right.
Okay, so what we expect from our clients, we just expect an open and honest approach. We want to know where you are in your recovery. Don't feel like you have to come in here and be very guarded. Open up. If you're open and honest with us, we're always going to work with you. It's when you get away from that we're blind to what's actually going on.
Right, and having a positive attitude and a positive attitude about change. Change is hard. I think we all know that. And when you come in for treatment, there's a lot of change in front of you. And so we just ask that you have an upbeat and positive attitude.
100%. So open, honest, and positive and patient to this process where you are guaranteed to transform into that person that you want to become.
Yeah. But our ultimate goal with the patient is to get them up to coming just one time per month.
100%. And there's a lot of other facilities we've heard of where they force taper people. They get them into a good place in life, and then they say, okay, now we're going to taper you very quickly. And the patient gets scared. They get uneasy, and it ultimately leads them back to the drug use.
Yeah.
So you never have to worry about that with us. Our medical director is a board certified addictionologist. He's trained in the most cutting edge knowledge in this field. And as we know, that does not work. So when you come on board with us, we're going to listen to you, prioritize what you need, what you can do, and you never have to worry about a scenario as such.
Right. I mean, just like it has to be your idea to get clean in order for it to work, it also has to be your idea to taper off of Suboxone.
100%.
That has to come from internal. And so we're not going to put you on artificial timetables. We're going to put that decision squarely in your hands and give you all the tools to make the appropriate decision on when and how you will taper off the medication.
So, to get involved, you guys, please go ahead, call, ask any questions you might have, look us up on Google, read our reviews, get involved, watch our other YouTube videos, because we are just expanding to the next level, and we want you to be part of that expansion.
Yep, 100%. We look forward to seeing you.
Indeed.